Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, I think you're really going to enjoy today. I know I am. I've been an admirer of this gentleman for quite some time. He set the trend. He was the initiator. He was the beginning of what we now know as alternative medicine here in Western Pennsylvania. Back in the day when it was very little known about it. Of course, he hails from up in the northern area. His offices were in Cranberry. He's moved on to bigger and better things. We certainly have met up and now formed a doctor-patient relationship. I'm talking about none other than Dr. Don Mantel. You may have been a patient of Dr. Don Mantel's. You may have asked, what happened to Don Mantel? Where did he go? Well, we're going to let he tell you about all that he's been involved with for a number of years and share with you some of his observations as he's observed this alternative medical thing really catch on to the point it is today that this is now commonplace and understood by most. Even though it may not be pursued by most, it is understood. And we want to have Dr. Don Mantel take our airways today and describe much of what he went through. Also, too, he has a different perspective now. As a patient here at our offices, he wants to share with you, it's how this whole thing got started anyway, he wants to share with you some of his impressions about what we do as a patient and as a physician. So I'm looking forward to our guest today, Don Mantel. He'll come with us right after that first break at about quarter after the hour. Now, look, if with our discussions with Dr. Mantel today, you want to call in to ask a question or make a comment, that number, of course, will be 412-825-6262. That's 412-825-6262, and I will give that number additionally throughout the hour. Okay, up-and-coming events on Monday. Well, first of all, on Friday will be our Open Up, Get 'em Up out of town version of the show in its most traditional sense. If you've been waiting in the wings to sort of jump on in and think, oh, it's not really the right time today, Friday is your day, we'll open them up for open phones and get you on out of here to what I understand is going to be a wonderful weekend, and look forward to having our departure on time on Friday morning. On Monday, we're going to come back and I've sort of compiled a list. I went over this rather quickly a couple of weeks ago, but because we tend to go in clusters here and have a great deal of emphasis on certain things we're doing, I thought it'd be nice to talk about all that we do here. So many unique treatments. Oftentimes, when I first launched them, we have made big fanfares of them, and then they sort of move in the background because something else takes its place. Well, Monday's an opportunity to sort of list them all out and have an opportunity for me to comment on each one of these in a more lengthy fashion. So things that we do will be on Monday. Speaking of things that we do and will be doing, up and coming, a lot of ways that you can participate as a listener and as a patient. First of all, you have been hearing us for some time now. This all really got started way back then in October, November with frequency-specific microcurrent after the conference I attended in St. Petersburg, Florida. And since that time, we brought Shannon Gosen to you, a practitioner from Jacksonville, Florida, who's really got quite a acumen and expertise in both the frequency and non-frequency specific forms of microcurrent. We've more recently brought to you two individuals. One, Mr. Michael Legal, L-E-G-E-L, Michael Legal, who is the president and CEO of a company known as First Alternatives. They're the sole marketer for a unique device, microcurrent device, referred to as Avasia, the inventor of which is a pretty famous guy. His name is Tim Smith. He was the key to the success of Texas Instruments back in the day, and then he went off to NASA and did wonderful things there. Now he has had this entrant into the marketplace where we find it to be extremely helpful, especially in treating pain problems. Now, the company called Avasia, we've done a number of shows on them, but you responded, you have the interest, you want to learn more, and we have the opportunity to invite you, if you'd like to be a part of it, to a training session that's going to be held here in the month of August in Western Pennsylvania, right downtown at the Westin Hotel. Now, the festivities surrounding this training program will be that preceding it for a number of days will be the National Convention for Massage Therapists. They'll be coming here to Pittsburgh from all over the country. They start on the 19th, and they complete their convention on the 22nd, which is a Saturday. So we're going to be a vendor in their vendor area, we meaning the Avasia people, and there will be a number of folks who will want to get and purchase an Avasia unit, and they would really like to be trained in how to use it sort of before they get home, and that's why it was a great backdrop for them, the massage therapists, and for you. Here you are, Western Pennsylvania. We're bringing a training session right in your own backyard, and it will be on Sunday. It's an all-day thing at the Westin Hotel, which that's the hotel that gloms onto Lawrence Convention Center. Now, if you have an interest, a couple things you can do. One, if you do not have and have not purchased an Avasia unit, it's really easy for you. All you do is go to not Avasia.com, but First Alternatives, that's plural, firstalternatives.com. On the opening page, click on the icon marked Training, and then you'll see as you scroll down the page the August 23rd date, mentioning the venue here in Pittsburgh. Click on that, and it takes you to a page where online you can fill out your registration. The fee for the course is $250, and talk to you in a moment about how you can get some of that back. You're all set, and you'll be able to enroll for it just on your own, at home, online. Now, if you have already purchased and own an Avasia unit, you are entitled to a discount, a substantial discount on this conference, except when they put the registration together, they didn't get together a form that allotted you an ability to declare your ownership of the unit you already have to qualify you for the discount. So in your case, don't register online for this course. You want to come on in at 8 o'clock on the 23rd and be able to register in a paper fashion so that you can get credit for your Avasia unit by, probably have it in hand, and having the serial number will entitle you for a substantial discount in the course. So one way or the other, if you just have an interest, don't have a unit just yet, maybe even thinking about one. By the way, if you purchase one during the conference day and the seminar day, you will get the discount applied just on the spot. So a lot of ways to get enrolled. We hope that you'll take us up on it. We're getting a lot of interest on your part. There are many of you out there who I know personally who will be there, and I know I'll be there, and I'll be one of the participants, as well as a lot of members of my staff. Avasia is coming to town. It's only right, after all. We launched it here with you, and we are the sole designated distributors for this Avasia equipment here in the entire Western Pennsylvania area. Okay, other things up and coming. Well, they're sort of going on as well as up and coming. We're talking about the various eye programs that we offer here. As you would well know by now, if you listen to this show at all, we've been really involved with eye treatment programs Personally, I've been doing them with Dr. Edward Condrat now for 2 years. Started back in July of 2013. I'd worked many years with him as an assistant, but we took over the northern affiliate for the Healing the Eye and Wellness Center, which is located in Fort Myers, Florida. And we started to have these 3-day treatment programs that we offered with the participation of Dr. Condrat, just without the presence of Dr. Condrat. And we have met every one of the outcomes. We have the exact same outcomes that Dr. Condrat has when he manages these programs. So we're really pleased to report that to you. Anyway, we got a 92% success rate, substantial improvement for retinal diseases in 3 days. And if you've listened to this show, you're pretty comfortable with hearing that. If it sounds strange to you that something like macular degeneration or glaucoma or diabetic retinopathy, or we found out the other day macular hole or macular pucker or retinitis pigmentosa, all going virtually nowhere with conventional treatment because there really is no conventional treatment for them. To find out that we can get this reversed and established on a course to restore your vision. It won't be completely restored in 3 days, but it'll be well on its way 92% of the time. To find out more about it and to allow you to become enrolled in it, you can do a couple of things. One, you can head to the website. In our case, we're known here in Pittsburgh as the Pittsburgh Eye Protocol. Once again, the northern affiliate of Healing the Eye and Wellness Center located in Fort Myers, Florida, which is Dr. Ed Condrat's creation. He really launched these kinds of treatment programs 15 years ago and then moved throughout the entire United States on a regular basis, pulling into various towns throughout the country for his 3-day programs and then heading to another one and yet another one. He doesn't do that anymore. He packed that all in back in July of 2013, and as a result of it, we really benefited and have a formal presence and a fixed site to offer these programs. Very difficult to find throughout the United States. We're proud to be a member of the Dr. Ed Condrat group in that respect. Eye programs, one's going on right now. It started on Monday. It has a 3-day component for the retinal diseases, and if cataracts, our newest addition to being able to provide a relief that says to you, you do not have to have that surgery. The surgery we're talking about is so commonplace when it comes to cataracts. You're used to hearing from your eye doctor, well, you have a cataract, it isn't ripe enough yet, or it is ripe enough, and you'll have to go to an ophthalmologist who will take that cataract out, which is a misnomer. The cataract doesn't come out. The entire lens comes out, and a new one put in its place, a synthetic one, which has some problems that a lot of people would like to avoid. Anyway, we now have a cataract program. It's a 4-day program. We had one more day to the already very famous 3-day programs, and we offer them here for you. So, to find out more, number one, you can head to our website at pittsburgheyeprotocol.com. That's pittsburgheyeprotocol.com and read about what we do. We actually link on to Dr. Ed Condrat's website in a number of places when we think that you'd like to get a little more information and background. Or you can call directly to Sister Sarah and ask your specific questions of her. She's fielded them all by now. That number is 724-993-0500. That's 724-993-0500. The eye discs. We put this together. This is most recently launched. It only became available last Thursday. But a lot of eye programs that we've done here on the air qualified as platinum versions of our show, and we put them all together in a disc. All 3 shows are on that disc. One, something that Dr. Ed Condrat was involved with back in December of 2014, entitled The Watergate of Eye Care. More on that another time, but there is a sinister and very controversial, conspiratorial story to be told about these injections that the retinal specialist check in the back of the eye. Another show, Dr. Todd Wiley. We met him a few months back. He is the eye doctor from Spokane, Washington. He introduced us to the Beamer, and what an introduction that was. We've been driving the Beamer around in our office for the last 2 months, and patients are benefiting from it daily. And then finally, after we did our first cataract group in a treatment program, we just had to report the results to you. And Dr. Lisa Bowen, our eye doctor that sees patients on the first day of our programs and the last day, was so overwhelmed by what she saw. She just, we begged her to come on. I take it back. She doesn't like coming on the radio, but she consented. And so those 3 are on a disc. For $5, we'll be happy to give you one of those discs and either keep it for yourself or pass it on. Okay, let's do this, folks. We're going to take a short break. In the interim, we're going to be switching some gears and moving to a real pleasant discussion today from a real wonderful guy, a great doctor, Western Pennsylvania's first, one of the first in alternative medicine, is our guest today, Dr. Don Mantel. Be right back in a moment with Don. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday morning version of the show, and a well-anticipated show it is. I've known this gentleman, I've known of him for many, many years. Couldn't seem to locate the guy, but I was certainly admiring of the kind of medicine he practiced and have modeled myself in that same approach that's now become amplified over the last 20 to 30 years. But he was available to you patients, especially up in the north, bringing to you, the first of the doctors to bring to you the ability to be treated differently when it was really not understood well by many, as it is today. Of course, I'm talking about the pioneer in alternative medicine. His name is Dr. Don Mantel. He consented to coming with us today, and we're going to take a little trip down memory lane and then switch some gears and go up to the current Don Mantel and what's happening with him. Let's say good morning and welcome aboard Dr. Don Mantel.
Good morning, Dr. Courtney. It's a pleasure to be on your show.
Well, I hadn't really thought of inviting you on the show. Just didn't really hit me until it was a week ago, and you said to me, I'd really like to come on the show and talk about what you're doing here. And
since you helped so much, I think that's the least I could do.
Well, that moment you said it, I went, oh my goodness gracious, what a great resource you would be to bring on the show. But I couldn't limit our discussion to what I'm doing with you, and we're certainly going to get there. I'm going to take the opportunity that really needs to be taken, which is let's discuss the Don Mantel career as it had unfolded over these many years. Um, why don't you take it from the top? What was the avocation? How did the avocation to medicine really come to touch you on the shoulders and move you into becoming a physician at all? What were your aspirations as you moved into medicine? When was it that some sort of light went off and you clicked into other gears that took you on a different pathway we now refer to as alternative medicine? I'm going to throw it to you just for a moment, talking about Don Mantel in the early days. How did it all start, Dr. Mantel?
Well, first of all, I came from a medical family. My father was a doctor. My uncle was a doctor. My brother claimed to fame. He's a dermatologist out in California. And so it was sort of inbred in my family to become a medical doctor. Now, I started out in the field of rehabilitation medicine, so that I was working with pretty heavy-duty medical situations: spinal cord, quadriplegia, paraplegia, strokes, head injuries, this type of thing. And I was pretty discouraged what I saw in the hospital, and how I got into holistic medicine. Well, to take that a step further, for example, we see patients 3, 4, 5 back surgeries because they'd have one, and they'd get scar tissue, and they need another. Same with carpal tunnel, this type of thing. So I was really discouraged. And then I ran into, when you talk about me being a pioneer, I have to give credit to Dr. Murray Susser. He was really one of the first ones in this area. He sort of took me under his wing. He was practicing in Valencia, PA, and I started working with him, and that's where I learned a lot of these holistic modalities. And then after about 8 months with him, he decided to go out west, first Oklahoma and then California. So I was sort of on my own. It was either sink or swim, and I started my own practice, eventually working out in Cranberry Township for about 17 years. But we really had like a supermarket of holistic health, especially back in 1983, when this was just practically unheard of. For example, we were doing IV chelation therapy, intravenous hydrogen peroxide, heavy nutritional therapies, applied kinesiology. I had a naturopath who was working with me, who did massage therapy, hydrotherapy, nutritional therapy. We analyzed visual fields to see what was lacking. I had a chiropractor working with me. I had a nurse who not only did all the IV therapies, he did the allergy testing, the sublingual mucous membrane testing, which really no one was doing that anywhere in the area, which is a very effective way to treat allergies by finding out what the neutralizing dose was for each antigen, whether it was a food, chemical, inhalant, did not matter, making up drops. We also had another person who did electroacupuncture, dark field microscopy. You had on your show a while back Dr. Miller, chiropractor from
the great one.
And I went with him to Germany to study dark field microscopy, which is a fascinating field. So I had a ice dark through a microscope, which we use with patients. Also did colonic hydrotherapy, which is, the colon, how important that is. So we really had a lot of different treatments we were doing, but it was all geared to getting to the cause of the problem and correcting it naturally versus an allopathic approach. And, we had 2 houses we were using to accommodate everything we were doing. So I have to say it was really a very interesting time, and treated a lot of patients and had a lot of success.
Well, you had quite a staff there. I mean, I just heard you tick off about 6 or 7 individual clinicians that worked with you. That was certainly unique. It's even unique to me. I don't have that many staff members even this very day. So you jumped in fully up to your neck. You couldn't offer patients enough. And this was at a time, you say 1983, this is at a time, I believe, when these alternative concepts were not very well understood. Where did these patients come from? Were they knocking down your door to get to you? How did they find out about you? What was it that was the appealing factor to them? Because you were so successful for so many years. How did the public respond to this young doctor up there in the Cranberry area doing these new and different things? How'd you get the word out?
Well, like yourself, believe it, I had a radio program.
You had a radio show.
Yeah, which I did every week, and then I would speak at different health fairs. Also, the organizations like yourself, ACAM, Great Lakes Medical, Great Lakes Academy, Clinical Medicine. And then, I didn't mention a big area I worked with was cancer. Very few doctors all over the country that would look at alternative approaches for treating cancer. So I still am on the board of directors of the Cancer Control Society, which is the largest organization in the United States that's propagating information on alternative clinics and doctors all over, not only in this country but all over the world. So I would get a lot of referrals from them, and because there were just not many people around this area that would work in that area. So and then that, and then word of mouth was a really big way to reach patients. But since there were so few doctors doing this, there wasn't a competition factor per se. There were a few doctors, but as I said, it was pretty limited.
Well, it was such an abnormal concept. I'm intrigued by the patients, and of course having a radio show really helped. I can understand now where you had an outlet and the ability to put out there for those who wanted to hear about this unique doctor practicing up in the North Hills of Cranberry area. That's where I can see the public responding, because even back then they weren't happy, Don, with the way they were being treated by conventional doctors. And that discontent. Yes, go ahead, Don.
Yeah, absolutely. I mean, you've seen this too, how many horror stories we see with the way people are treated. And a lot of times the treatments are just devastating. They're worse than the disease, especially with cancer. I'm not saying all these treatments are bad. Sometimes some of them are necessary, but for the most part, it's overkill. Things like chemotherapy, radiation, and a lot of times the surgery is not necessary. But, people didn't know there was other ways to approach this. And the interesting thing was it wasn't totally all or nothing. I mean, we have had patients who went through conventional treatment and did alternatives and did that much better. We took care of their immune system, tried to work on the cause of the problem. So, it was a tremendous addition to what patients knew of in their narrow scope of the disease.
Certainly appreciate it. Now, there you were, and you say 17 years practicing in Cranberry. And of course, I didn't meet you back then. I was certainly aware of you, because as you were coming to the end of your Cranberry experience, I was just getting started. And as you described, you were lucky enough to be mentored by a Dr. Sussman. All of us really have to be mentored by somebody, because there's really no school we can go to for this. So you're lucky enough.
ACAM, and they have seminars and workshops for like chelation therapy and others. And then there was other seminars I'm sure you took, like, for neurotherapy. I didn't mention another treatment involved with Dr.
Dr. Klinghardt.
Klinghardt. Yeah,
Sure.
quite a few seminars from him. And in fact, I did towards the end of my patient career there. I did take seminar on ozone with
Dr. Schallenberg.
Right, Fallon, thank you.
You're one of the originally trained by Frank. It's just amazing to see how multifaceted your practice was and so far ahead of its time. I'm a Johnny-come-lately compared to you, doctor, and really to see how advanced you were and all the therapies that you offered back in the day. There's no reason, a surprise, I guess better said, no surprise that your name was infamous in this neck of the woods. And it's because you did so many things and offered the ability of patients to pursue another avenue to correct their health issues, ones that weren't so problematic with risks and side effects as well as we find with the conventional therapy. Now, at some point, I'm guessing that happened somewhere around the year 2000, you packed up and left the Cranberry area and moved up in, I'll say the woods, I think you'll say the woods, someplace called Sarver, PA. What prompted that move? Because it's a great change in your practice whenever you shifted from Cranberry, which is a pretty populated area, to Sarver, which I'm getting the impression isn't too populated at all.
Right. Well, in hindsight, it might not have been the best move, but at the time, I had a 250-acre farm where we raised cattle and sheep, llamas, and I was commuting 50 miles each way to Cranberry from, I was in Armstrong County.
Okay.
Up past Apollo, PA. Sure. So that was getting old, so I thought, why not be closer to where our farm was and where we were living. So we moved to Butler County, Sarver, and I said in hindsight, it really was not the greatest idea, I don't think. Because
well, you must have had some.
And in the rural area.
Sure. I mean, I think what evidently happened there, you really wanted to move into the farming realm, but patients either lost you, couldn't travel the distance, so the practice went from a burgeoning one to a rather limited one, or maybe it didn't. Huh? Did people still drive all the way out to Sarver to see you?
Yeah, but unfortunately, like my nurse retired, other employees retired, and things were sort of on the decline. So after about 7 years there, I actually moved my practice to my basement of my home, worked out of the basement of my home, downsized. But, yeah, it was just a matter of things changing at that time, and I was looking to, downsize.
Well, now, the number of years you spent out there in Sarver, eventually things moved in a direction that you said, you know what, I need to get out of Dodge now, and I'm going to move again. And more recently, you now back in civilization, you live near or around the Murraysville area of town, right, don't you?
Yeah, Murraysville, but I'm out in the country.
You're out in the country, but you're in civilization.
What's that?
You're in civilization. You're not too far out in the country, I think, is the way to put it. Because when you were in Sarver, you were way, way out there.
Right.
And so
essentially what happened was, when you're treating my wife also, she's somewhat disabled. So I was like her sole caregiver, and it was just too much for me to keep practicing and taking care of her. And, I just started breaking all the rules I know I shouldn't be and brought on the health. Well, what happened was essentially, beginning of February, I had a head-on collision, and lucky to walk away without a scratch, 40 miles an hour, but, it developed a severe sciatic problem, which chiropractor, believe it or not, like 4 treatments, alleviated all pain there. But then that sort of weakened my body, and I month later, I wound up in the hospital with acute viral pericarditis.
Oh boy.
And in a way, I have to say it was a positive experience because all the things that I was preaching to patients happened to me. And what I mean by that is the doctors got me, put me on Motrin. The pericarditis affected my kidneys. So then they put me on steroids. My sugars went up over 300. They had me on insulin. They couldn't control my blood pressure. They had me on 5 different medications for blood pressure. And then they had me on about 3 or 4 blood thinners. I mean, it was just unbelievable what was going on. My stomach, they affected my stomach to the point I couldn't eat. I lost 10 pounds. And when I got out of the hospital, I was able to regulate myself, my sugars, my blood pressure without any medications. And I really feel that I would have been in really bad shape had I continued the way.
They got a hold of you, Don. And as they do so well, nightmares result. And you literally had to rescue yourself. People listening to our discussion today are probably just shaking their head because they've had similar experiences, either themselves or other family members, and they've moved way away from the conventional approach. Yes, we all need, at some point, the assistance of really in-depth clinicians in a hospital environment, but these are at the tertiary care level and hopefully are short-lived so you can get on out of there and back to some sane ways of treating things rather than the well-deserved and well-needed therapies of tertiary care.
And what's interesting, I was watching last night, just phone up a video on Beamer, which I'm sure we'll get into, and they talked about the 3 major causes of death in this country. Number 1, heart, cardiovascular. Number 2, cancer. Guess what's the 3rd leading cause of death?
Be us, doctor. It would be us.
Misdiagnosed disease, misdiagnosed problems where they're taking medication they shouldn't be, or the side effects of the medication they're taking.
That'd be us.
The 3rd leading cause of death.
Yeah, that statistic doesn't change too much. It's right on up there. It hasn't changed for about 15 years now, and the numbers continue to rise. It's very embarrassing to think.
Dennis, this was a wake-up call for me and a very valuable experience because it led to me not only going to see you when you've helped me tremendously, but changing my diet gradually, which I knew about, but sometimes we're the last people to help ourselves. We're helping everyone else,
I know.
Especially with the stresses we're under. Changing my lifestyle, and gave me a new lease on life. But this wouldn't have happened if I hadn't reached rock bottom.
Yeah, we're getting it turned around, no doubt about it, Dr. Mantel. Why don't we do this? Let's take a short break to allow us to really shift some gears. I want to, when we come back, let you do a major shift, which is from a doctor viewpoint, which we've been talking up to now. Now we're going to switch gears and let you talk about from the patient viewpoint, because we ended up meeting not too long ago, and all sorts of wonderful things have happened since then, and give you an opportunity to share with our listeners how you feel about those experiences, where you were when we met and where you are now. Fair enough, Don?
Sure.
All right, folks, you got him, the great one with us today, Dr. Don Mantel. We're going to switch gears. He's going to change hats and put his patient hat on and really be able to identify with you, the listener, who might very well be having some medical issues himself. Well, let's see how it turns out. We're going to take a short break. We'll be right back in a moment with Dr. Don Mantel. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Here in a Wednesday morning version of the show, our guest today, just a treasure of information concerning alternatives. He was there at the beginning of 1983. He set up practice and an illustrious medical career. He offered so many therapies, a lot of which we offer today. We're Johnny-come-latelys around here. To the pioneers, I tip my hat off to them, and to this gentleman, I've admired him from afar and had a chance to meet him more recently than I care to mention. Should have met him a long time ago. And voila, a radio show comes out of it. And so we're now going to go back to Dr. Don Mantel and let him switch some hats because, well, he actually needed to be assessed and evaluated. And I feel very honored that he came to me to do it. Let's say good morning and welcome back to Don Mantel. We're going to change some hats. You're going to put a different hat on for me right now?
Right.
Okay, so there you were, living in the Murraysville area. Now, as you well know, I do have a Monroeville office. That's where we first meet and are able to get an appreciation for your own issues and those of your wife. Why don't you maybe take it from the top? How is it that you made the decision to consult with me? What were the issues that you and maybe your wife were having at the time? What did we bring to you in the way of therapies to help you reverse those processes? And now that we're many months doctor-patient relationship, how you're doing now? So let's just take it from the top. You were looking for a doctor, and you decided to move.
I was seeing someone I had known who was doing massage therapy for my wife and I, and he said, well, you know, you should see Dr. Courtney. He has these ozone treatment, which is really amazing. And of course, I knew about ozone.
Yeah.
I said, wow, you know, I hadn't even given that much thought. So, of course, I went through the channels of contacting your office and making a point for my wife and I. And, you know, I have to say that I was in pretty rough shape because after the car crash and then being in the hospital, I found out very interestingly that I had a silent heart attack, which, you know, interestingly enough, they say 50% of these can be fatal, not even know about it. So here I've had a cardiovascular incident, and my family history, my father was diabetic, his father was diabetic, and I've had a problem with sugar for quite a few years. So, and then also issues with high blood pressure and
yes, you had a significant cardiovascular history, and we went directly at it, did we not?
Right. So, you know, before you recommend surgery, I just have to say, for me to do anything, like just walking around the house, I'm huffing and puffing. I didn't have much endurance at all, you know, and I was really concerned. I couldn't do very much, and my cardiovascular state I was pretty concerned about. So after doing testing with you, very extensive blood testing, ultrasound for the circulation, you recommended the ECP, external compression.
External counterpulsation, yes.
Counterpulsation and the Beamer treatment, which we went ahead and actually got our own machine and been doing that religiously. And, you know, I just telling you off air, I have a very steep driveway, and I was on the phone the other day, and they said, go check your mailbox to see if this package came. So while I was on the phone, I walked as fast as I possibly could up the driveway. In the past, I could barely even walk up the driveway without huffing and puffing. My legs were weak, and I went right up that driveway, no problem. I said, I can't believe this. Oh, what a difference.
I hear you.
You know, I'm no longer, you know, every time I go shopping, I have to do shopping for the household, I would get an electric cart because I just didn't have the endurance to walk around the whole supermarket. Now, that's no problem whatsoever. So I can only conclude that it's either the ECP or the Beamer or a combination of the two treatments that have had a tremendous change on my cardiovascular situation. and my musculoskeletal, because my left leg was weak from that car accident. And then my wife has severe osteoarthritis of her knees, bone on bone. She walks with a cane at home. She walks with a walker. And I have to tell you, being a doctor, I've tried every treatment I know with her to help her, and I haven't been able to do that. And when she started with you with the ozone, after a couple of treatments, she's noticed significant change in the pain situation in knees. And by the way, that's still continuing to this day.
Oh, goodness.
So that's a miracle after how many years. Back in 2000, 1999, I turned the car over. That's when her problems started to accelerate. Get it on black ice. And as I said, I've tried everything, every treatment you can think of with her. And he's just pressed onward.
Well, concentrating on you for just a moment, you had more than just a couple of issues that were pointing directly to the cardiovascular component, and this is one that we have focused in on from a clinician viewpoint way back when we first started this kind of work. And we began to present ECP as a viable option 15 years ago. And then most recently, we bring the Beamer into the picture. But the two of these treatments together probably are able to reestablish blood flows better. Well, not probably. They do establish blood flow to all areas of the body, every crook and cranny of the body, in a way that allows these tissues to function normally once again. I get a kick out of you talking about literally racing up your driveway, because I would just say that I think that you're able to have such a cardiovascular wallop now, where it was a sluggish system for you before. This system is now beginning to function in a top-notch way and provide you the opportunity to carry on your lifetime activity. Yes, even going up a very steep driveway is well within your abilities right now, and it even surprised you, didn't it?
Absolutely. And another that we didn't talk about was pain and energy. The Beamer, I've never seen anything work so effectively on pain with my wife, because there's very few things that alleviate her pain immediately, and the Beamer does that, which to me is just amazing. And energy, they say take 2 treatments a day, or in the morning and then late at night, 8-minute treatments. Well, sometimes after that second treatment, I'm not going to sleep because I have too much energy. It's just amazing to me what this machine can do.
Yeah, the Beamer.
Blown away by it.
Sure. It's great. The company, the Beamer company, has quite a successful program in allowing patients initially just to rent the device.
Right, that's what I did.
And over the course of 8 weeks, I think you evolved to the point where I find most patients, you wouldn't surrender that device if threatened with the dissolution of your firstborn. I mean, you will not part.
What a godsend! It's a new lease on life. It's sort of like where are they searching for the fountain of youth? Now, I'm not saying you're going to live forever, but my understanding, because of what you're doing for the microcirculation and its cumulative effect, when you die, you're going to die whatever your full potential is in years. You're not going to die prematurely or even what they predict your age, because what they're saying, 80% of all disease is caused from the microcirculation. And that makes a lot of sense. That's where the oxygen is provided to the cells, and the CO2, the waste products, are transported out, and where the cellular processes are affected at the cellular level. This is all directly influenced by the Beamer, proving that microcirculation.
Yeah, I think the way I'd like to describe it is ECP, which is external counterpulsation, and we do offer it at our Monroeville office, which have made it more convenient for you. Would probably be very difficult for you to travel all the way to McMurray. Right. So very nice that it's available for you folks who live in the Monroeville area to be able to develop brand. Now, this is what ECP does, Dr. Manda. develops brand new blood vessels you don't even own right now, or you didn't own when you began it. And the vasculature, in terms of the amplitude of it, burgeons because of the 35 treatments for the ECP that gives you that new set of microvasculature you didn't own before. But then when you combine it with this beamer using pulse electromagnetic fields, you're able to perfuse those old vessels and the brand new ones to such a degree you are sending gushes of blood and nutritive material to aspects of your and crooks and crannies that you own that hadn't seen the blood flow for probably 10 to 15 years. And now blood is freely moving into all areas thanks to the two of those therapies combined. I find them to be a 1-2 punch that has no equal. And the way you bespeak of it on our show today, at least I'm sort of smiling to see that you got such great results, and you base it to the correct resource of developing microcirculation and blood flow to it. And we're going to do nothing but continue to improve on that. You're not done. You're just starting.
Wow. Well, what blows my mind is that more doctors in Pittsburgh, which is supposed to be a medical center, like for transplants and everything else, that there more doctors are not doing ECP. I mean, this is a resource that they're missing the boat on. And I can understand, in part, because my research, I went online and I was looking at ECP, and they saw on Wikipedia and other sources, they say the only time they recommend ECP is when a patient is not a suitable surgical candidate or his angina cannot be controlled with medication. And, you know, they have it into that narrow scope. They are really missing the boat here.
They are really missing the boat. And, of course, that is true. Conventional medicine looks at ECP to be put at the end of the line when all else has failed, including the surgeries and stents. We put it in front of the line and get people the benefit to be able to avoid the stenting and the catheterizations and the bypass surgeries. So you're so adept to pick up. There's a giant error being made by the conventional medical community. I've talked to Dr. Oslam Saran. She's the one that does all the research up there at the 7th floor of Presby, and she admits that she had missed the boat on this one, and she's trying to come up with new literature to support putting these therapies first, not last. And they're just at the beginning. They're way behind us, Doc. We're way ahead. And, well, you were really way ahead because of where you were.
This is going to be available to a lot of people.
Well, it's nice. And then teaming that up with the Beamer, the most recent, I mean, that's the newest thing to hit my office. It's only been 8 weeks now, maybe a little over 8 weeks. And the benefits that are being obtained. You mentioned your wife, Jackie, who had a whole different set of issues, mainly painful issues, and just by using the Beamer alone, she's improved. And then I find out, and believe you me, it's a revelation to me today for you to say it, because I wasn't quite sure of how we do. As her second ozone treatment, she's been pretty much been able to maintain a pain-free left knee, where this was really debilitating to her before. You tell me the pain is still gone?
Yep. Yeah, her knees are not bothering her now, which this is a miracle after how many years of going through so many different treatments and whatnot. It really is.
Well, it's so nice to be able to help you out with the ozone, and I think we've done PRP, and we haven't done much. I mean, we've just, with the first injection.
I have to also add that her eyesight is somewhat improved with the Beamer. That's another pretty amazing thing.
And we have the Beamer we incorporate in all of our eye programs since Dr. Todd Wiley brought it to us. So, point for point, you're providing great testimonial information just from your own family about the multiple things we offer here, and it's sort of a kick to hear it coming from another doctor who is afflicted.
I'm making this up. I wanted to do this because I feel tremendous gratitude for what you're doing here. And, the nutrition, is extremely important, and I've been taking nutrition, but I, have not gotten the impact anywhere near what these two treatments did. I mean, like day and night.
Yeah.
I could say it's like it's like using a sledgehammer and a little hammer. These have so much impact, the treatments.
Well, the nutritional component, which was way out of whack with you, we identified it. You were adept enough to pursue it. You're now getting that under control. Each and every component that we raise up as showing a problem ends up being dealt with. And I want to thank you so much today talk about.
Thank you for what you're doing.
Well, we're going to continue to have a mutual admiration society between you and I. I hope to be able to bring you back sometime in the near future. We're to the end of our time right now, but Dr. Mantel, thank you so much for coming aboard today, folks. Hope you enjoyed the show and listened to the great one. See you on Friday. We're going to open them up on Friday and maybe get your comments about Dr. Mantel. Until then, this is Dr. Dennis Courtney with Dr. Don Mantel saying so long for AM Impact on Your Health.